He's well known as a leading eye surgeon, but Dr. Ming Wang is also a man of many other talents and a man who is guided by faith. Meet this man of many talents right now on Be the People. Greetings from Nashville, Tennessee. I'm Carol Swain, and this is Be the People. Each week we examine the social, cultural, and political issues that affect all our lives. Many Tennesseans are familiar with our guest today because of his reputation as a pioneer in LASIK eye surgery. Dr. Ming Wang,
Hi,
what
Carol.
a pleasure to have you on the show.
Thank you for the invitation, Carol.
I'd like for you to tell our viewers about the intersection between faith and science as you see it.
You know, Carol, this is such an important topic today with the rapid development of science and technology. And the science has been able to explain more and more things in our lives and being able to change our lives in many ways never imagined possible before. At the same time, at the core of our existence, we have our faith and beliefs. And
well, some people don't, but you do, and
yes,
I do.
And I think it's important to have one. And so it is an important question. We have to confront it and have to resolve in our own hearts a solution, that how we're going to go about it, the intersection and sometimes the conflict between science and faith.
And I know you struggled with your awareness that there could be medical breakthroughs using stem cells, and then your belief in the sanctity of human life. How did you resolve your struggle?
Yeah, it's been a very difficult journey for many years, and I still have to say I'm continuing learning and still trying to continue find the answer. In some cases, we have been able to. Basically, for example, stem cell, fetal tissue wound healing research. And as a Christian, we say, you know, Bible said human life, a baby, embryo is a fetus, is a human life.
It's always in the Bible, it says
exactly.
A pregnant person is with child. It doesn't make that distinctions that we make.
Exactly. At the same time, as a doctor, as an eye doctor, I face with the situation every day when you face with a patient with chemical injury trauma. Mm-hmm. We know that many of those injuries, we know, or genetic eye disease can be adequately treated or can be even possibly treated with research with stem cell and fetal wound healing research. And sometimes if we put ourselves in the shoes of a patient and we realize that, you know, how we're going to say no to research to improve the quality of lives. So this conflict between science and faith does exist in many branches of medicine, including ophthalmology.
But you were able to resolve it in one particular case. And how did you resolve it?
Yeah. We started corneal wound healing research many years ago. The patient with trauma injury, and initially they could see, but then they developed scar, which mm-hmm. resulted in blindness. And I was a medical student at Harvard in Boston, and I was working as a medical student taking care of these patients, and I asked my professor, how can we reduce the scarring? And professors say, well, that's a tough question. You know, however, we do know a child can heal much better. Here's the question, how can you study how the baby can heal so well without, and benefit the adult patients without touching any part of the baby? And we struggle with it, and obviously fetal wound healing research is a very promising area, but how can you conduct fetal wound healing research without touching any part of the baby? However, we persisted, and you know, Bible says, James 1:4 said that, you know, perseverance will make one complete. So we persevered, and we just continue work at the problem, and eventually found that the amniotic membrane surrounds each unborn child.
And that's the sac that encases the baby.
Yes, and we postulated perhaps the sac that surrounds the baby may confer the scarless, youthful healing property of the baby. So if that's indeed the case, then possibility might exist that we can actually without touching the baby, just
Right.
use the sac and perhaps transplant onto adult eye to recreate a fetus-like environment.
And so you created a contact lens that was made out of the
Amniotic membrane.
Uh-huh.
Yes.
And it has brought sight to thousands
Yes.
of people.
Yes, by recreating the fetus-like environment, you basically make the adult eye, the injured eye, think, oops, we're not born yet.
Right.
So they can regenerate again as they used to do before the person is born. So by using the amniotic membrane, in this case amniotic membrane contact lens, that we can recreate those fetus-like environment to help adult eye heal. And in this case, basically conducting fetal wound healing research without touching any part of the baby.
You know, I've read your Christian testimony, and part of that testimony is that you prayed and God gave you the insight that you could help people that were suffering, and at the same time, you know, you didn't have to destroy human life. And so that contact lens is just amazing what occurred there.
Yeah, and we tell mother who have babies, say, we wait until the baby's born, and after baby's born, the placenta with the amniotic membrane
Right.
always gets discarded. So
Yes.
instead of that it discarded, we harvest those and make into contact lens.
Okay, well, Dr. Wang, we're going to continue our discussion in just a moment. The journey into life that brought Dr. Ming Wang around the world, we'll continue our discussion with as you stay with Be the People. Welcome back to Be the People. I'm talking with well-known eye surgeon Dr. Ming Wang about how his life of faith has brought him through many obstacles. Please tell us what you think of Dr. Wang's story. You can email me at carol@bethepeopletv.com or contact us via Twitter and Facebook. There are many people around the world who owe their ability to see to the talents of Dr. Wang. But aside from his abilities as a surgeon, he's also an accomplished musician and ballroom dancer. Dr. Wang has also seen firsthand the devastating consequence of socialism in China, which kept him from furthering his education as a young man. Dr. Wang, tell us about your experiences in China.
I grew up during what we call Cultural Revolution, or really Cultural Holocaust. For 10 years, between 1966 and 1976, the dictating government decided the best way to keep on governing is to make people ignorant. And best way to keep people ignorant is to...
I think we're trying that in America right now.
Yes, very sadly, in a way, that the best way to keep people ignorant is to destroy the educational process of its young people. So all colleges were shut down for nearly 10 years.
That's
and millions
awful.
were sent to a countryside and condemned a life of poverty and hard labor. And I caught that during the mid-1970s.
Now, were you, were any young people selected for college?
No, most of the 99% of them were all shut down.
So what happened to you?
So I was graduating junior high, and I was told by government I will not be, I have zero chance to go to college, despite the fact I was a straight student. And I would be deported just like millions of others, and having a life of poverty and hard labor for the rest of my life.
Did you understand that as a child, what that might mean?
I did. I was 14 years old, and it was particularly even more devastating to my parents, and they really struggled. And it turns out the one way to escape the deportation is to have a music talent. And because communist government still have song and dance troops, so they
Right.
need musicians. So I picked a music instrument and dance. Now it's a hobby. People say, oh, you have a hobby, so nice. No, I said, I learned those at the time to survive.
But you became a top musician, right? With that skill.
Yeah, it's with the Chinese violin, and also learned dancing. And I remember as a young man of 15, I was playing the instrument, some sad songs that resonating with those feelings. But at the time, one should be looking forward to a lifetime of possibilities.
Now, were you Christian then, and were your parents Christians?
No, I was not. And 95% of folks in China are not Christians, even today. And my path of seeking Lord came from a pathway that I was trying to find answers to many things that I was seeking answer for. I thought I could find all of them in science, and I came to this country with $50, with a Chinese English.
$50?
Yes, with a Chinese English dictionary, but with a big new country in front of me, you know, with American dream. And I got enrolled in a graduate school to study laser spectroscopy and then medical school. But I always thought I could find answers in science. But interesting thing I found is the more science I've learned, the more unknowns I've discovered. So then I realized it must be some explanation for some of the larger questions I was seeking answer for. Then I was influenced to Christianity by a professor who I respect a lot.
A professor at Harvard.
Yes.
Well, when we come back, we're going to finish our conversation about this. Welcome back to Be the People. On this program, a look at the fascinating life and faith of renowned LASIK surgeon, Dr. Ming Wang. Dr. Wang, let's talk a little bit about your scientific innovations, because I know that you have numerous patents and that you're quite an inventor.
I've been very blessed, as I said earlier, that having the opportunity to study, to learn in this country. And we've been involved in developing many new technologies, but two specifically. One is 3D LASIK, using the digital technology to improve the quality of LASIK eye surgery to correct nearsightedness, farsightedness, and astigmatism. Traditional LASIK surgery uses analog technology, not a digital. And I was the first to develop working with the digital technology to adapt to LASIK surgery, so we can improve the accuracy and the safety and the visual quality in our patients. The 3D LASIK, the digital. The difference between 3D LASIK and the conventional LASIK is the difference between iPhone and the regular camera. So it's a digital.
And you also do what, bladeless cataract surgery? How does that differ from if you know the kind that they use a blade? Or?
Yes, it's, we know that in 21st century we know the precision and the reproducibility and the accuracy of laser far surpasses any human hand operation. 15 years ago, vision correction went from RK blade to LASIK laser. 15 years later now, for cataract surgery for older folks, same revolution is taking place from blade to laser.
Now I know you have an MD from Harvard where you graduated with honors. You also have a PhD in physics?
Yes.
Is this medical physics or physics? Physics,
actually quantum mechanics, yeah. And
so you married the two together to create these inventions.
When I was studying, I got my first doctorate degree in laser physics and then second doctorate degree in medicine. I was thinking, you know, at the time I was Christian already, and I was thinking, why God put me through all these years of study? I was in school for 31 years. And now I see God's design that, you know, He wanted me to apply the combination of medicine and physics, optics, lasers, and can improve the quality of care for our patients.
And people are coming to you from all over the world, and we're so blessed to have you in Middle Tennessee, and we hope to keep you here.
I enjoy living in Nashville. You know, this is a Bible Belt, and it's a vibrant, Christian-oriented and family-oriented society and environment, and it's continued to become more and more culturally diverse as well.
Yes, it has. And how do you find time to do the ballroom dance? I've actually seen you dance at the same studio because I was taking lessons for a while.
Okay.
And you're still doing music, you're still dancing, and you're very much involved in the community, and you're doing research and surgeries.
Yes.
How do you manage? You're one person and there's only so many hours.
Yeah, we are active in research with many FDA clinical trials for new treatments and new technologies. I would say the simple answer is if one loves it, you make time for it.
Well, I can sort of understand that.
Yeah. And also, by being involved in music, in this case, for example, ballroom dancing, you know, to be a good ballroom dancer, you can't just dance off by yourself. You have to understand and feel and aware your partner, and you have to dance together. So it helps you be a better listener, be a better person to be aware of the feeling.
Do you always
of another
dance
person.
with the same partner?
With my wife, yes.
Oh, okay.
Yes. And sometimes with other friends as well. But learning dancing helps you become more sensitive and to be better connected to another human being, and which helps me become a better doctor.
Well, when we return, I want you to talk about what it's like being an immigrant in America. My guest here on Be the People is well-known LASIK surgeon Dr. Ming Wang. Dr. Wang, tell us what it's like being an immigrant in America and sort of seeing the direction our country is moving, because some people would say that America is becoming a socialist country. Is that exaggerated?
It is, I think, in fact, true that many immigrants, such as me, have left countries, China, Russia, different countries, because socialism, the entitlement, the government-controlled society has only made people poor. In China today, the economy is developing better, not because of socialism, but because of capitalism. And so what I'm seeing in this country as an immigrant is a troubling sign that this country is moving in the direction of the country that many of the immigrants we have left from.
Is there anything that you think we can do, or any way that you can warn Americans about this path? Because some people, they become very comfortable with the idea of big government and government trying to meet people's needs.
What's most precious about America is freedom and choice. America is a magnet attracting people from around the world. And that's the fundamental definition, the godly principle of freedom and choice. And I think we can help Americans realize how precious the freedom and choice is, and how important to preserve that and don't let this country slide towards the dead-end socialism by having people like me talking or shared experience of growing up, having been there, done that, and also traveling to other countries to see, to feel, and to communicate with people who will say, we want to be like you, America. We don't want you to be like me.
It seems like people don't appreciate what they have until it's gone, until they lose it.
Unfortunately, that's the case. It's the people who appreciate sight. The most are those people who have lost sight. So the challenge is upon us now. Can we truly appreciate freedom and choice before we lose it?
Now, Obamacare, or the Affordable Patient Health Care Act, does it affect your practice? Does it make it easier or more difficult for people to get the help they need?
It's not going to help. It's going to make the sense of entitlement and the whole problem. The fundamental problem in American healthcare is citizens are not taking responsibility for their own health. For some reason that one needs to save money to buy a house, buy a car, but for some reason you don't have to save money for your own health. Yeah. And that's at the root of the problem. Obamacare make that sense of entitlement worse.
And I believe that the health savings account that many people have, and they can use it for flexible spending,
yes,
that will be eliminated under Obamacare.
Exactly.
Yeah, I mean, that's what I have heard, but that would be a big concern.
Yeah, those health saving account is a good approach because it make people aware that they need to save up money to improve their health care. So I think the fundamental thing wrong with Obamacare is it increases, not reduces, the sense of entitlement, and which is at the root of the problems in America today. Not just in medicine, across the whole society, the sense of entitlement.
Well, I certainly hope you get many opportunities to share your experiences, and it may turn out that for America, it will be immigrants like you that will wake us up to what we have and what we're losing as a people.
Yes.
Well, it's been a real pleasure to have had you on the show, and I hope that we can have you on the show again to talk more about, the socialism, about the health care. There are just so many issues that are of concern.
Thank you, Carol.
Okay.